Hello and welcome to our show today. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Did you know that every 60 minutes someone dies from an oral cancer? Oral cancer is categorized into head and neck cancer, which make up about 3% of all cancer cases in the U.S. Tobacco and alcohol use are the major contributing risk factors for oral cancers. In addition, the human papillomavirus causes more than half of other head and neck cancers. Joining me on the show today are some experts from Dr. James Pickens' dental office in Murray, Kentucky. Today they are going to share with us the importance of oral health and cancer prevention, but also some exciting information on a test you can take to find out your risk for oral cancers. Thank you for joining me today. And if you would just each take a few seconds just to tell us who you are and exactly what you do at the dental office. So, Dr. Pickens, do you want to start?
I'm Jim Pickens. I've been a dentist since 1986. I graduated from U of L Dental School.
All right.
I'm Leah Smothers. I'm the registered dental hygienist at the office. I've been with Dr. Pickens for 11 years now, and I'm the one that you'll see in the office actually administering the mock testing.
Okay.
I'm Cheryl Rawls. I'm a certified dental assistant, and I've been working for Dr. Pickens for 7 years.
All right. You got some long-term staff there with you today. Good. Well, let's first just start out with just some general oral health, what people can do for oral health and preventive screenings, and what should everyone do every single day to maintain good oral health, just starting out.
Everyone should brush twice daily at least and floss once a day.
Okay. And sometimes that seems like it takes people, you know, people will find excuses as to why they can't do that. So, but really, in realistic minutes, how long does that really take to do?
Brushing takes about 2 minutes, and then flossing maybe a whole 30 seconds.
There you go.
And brush your tongue.
Yeah, people don't think about that either. That's good advice. So how often should someone be coming to the dental office to see you all?
Regular checkups every 6 months, and if the patient has periodontal disease or any risk factors such as diabetes, that could be a little more frequently.
Okay. So best they definitely go and you all get them on a regimen that's right for them. All right. And how often does a person need to have x-rays done? You know, you do x-rays when you go to the office, but some people don't understand why they're done or how often they need to be done. So could you all explain that a little bit?
A full mouth set of x-rays is recommended every 3 to 5 years, and bite wing x-rays, we normally do those once a year. And any additional x-rays, just as the need be if a patient is having a toothache or any problem is occurring.
Could you explain a little bit about the difference between those two x-rays, the ones that you do get annually, once a year, but then the other one that you mentioned in the span of 3 to 5 years?
The 3 to 5 years is an x-ray of every tooth in your head. It's actually 18 films. And that checks all the way to the root of the tooth. And the ones you do once a year just check in between your teeth for cavities.
Okay. And Dr. Pickens, I have a question for you, a side question from what she just said. From a provider standpoint, for those 3 to 5 years, you've been in this industry for a long time now. Have you been able to catch some oral cancers at a much earlier stage with this new x-ray?
Not really with x-rays. I found one at Christmas.
Okay.
A person that didn't have any teeth left but had it on a white spot came up on their gum, and we referred them to Vanderbilt, and there's a head and neck oncology department there that take care of these kind of problems. And sure enough, it was cancer.
Wow.
So.
Is that the only cancer you've ever found?
No, there's more.
Okay, all right. What are some risk factors for oral cancer?
Men greater than 44 years of age, smoking, alcohol abuse, and poor oral hygiene.
That's a big one.
Yes. Human papillomavirus, and I think just a great way to prevent all this is moderation. If you're going to do these bad habits, you need to really be moderate in what you do.
Right, right. And definitely you all serve as, you know, great counsel for them as well, to be able to find them resources to help them stop if they do want to stop one of those.
The Murray-Callaway County Hospital has a smoking cessation program, so they can enter that.
Awesome. And a lot of different places in our community certainly offer classes like that to community members, so we definitely want them to take advantage of that. So it's
Right.
great that you all can refer them to some resource to help them. So what are some symptoms that someone might experience if they might happen to have oral cancer?
Oral cancer can be pretty silent.
Okay.
There's a term called leukoplakia, which is a light-colored white lesion that's precancerous. Erythroplakia, which is a red lesion that's precancerous. Bad taste in your mouth, change in your voice, and those are just things that are uncommon, and you should be, if you notice this, you should see somebody about it.
Okay. If someone has a lesion of some type in their mouth and it doesn't get better in, say, 2 weeks, do you think that's kind of the mark where they need to go, or would you say they need to go?
Right, I would think then if things aren't, the lesion's not getting smaller, a biopsy should be done.
Okay. All right. Great advice for someone out there listening today. And so where exactly can oral cancers happen? You know, there's actually a lot of different parts of the mouth.
Right.
So
The
we'll have
floor
a
of the
diagram.
mouth is the most common.
Okay.
Lips, gums, tonsils. I had a friend that had tonsillar
Wow.
cancer.
Okay.
The oral pharynx, the hard palate, the soft palate. About everything in your mouth, the tongue too, except teeth.
Okay.
So it's all susceptible to it.
And that's all oral cancer. That's
Right.
just grouped into
Right.
that. Okay. What are some preventive measures someone can take to help decrease their risk for oral cancer? Obviously, you talked about some of those behaviors that they have,
Right.
such as smoking and alcohol. We can either limit that or help them to stop, but what else can someone do?
The oral hygiene is probably one of the best things to do. Like we talked about earlier, twice a year or more if you have diabetes or some other kind of metabolic disturbance. So.
And in that includes the regular oral cancer screening that we will visually do when you're in the office for those procedures.
Right. And then as a dental hygienist, you can actually, if someone actually has problems and not really knowing the correct way to brush or to floss, you all are the ones that can really sit with them and teach them that.
Detailed instructions, and do that all day, every day.
Good, good. So if some people are scared and maybe they don't know how, they may think that they're at home doing the right job, but they're not. I mean, I've been corrected before on how I was flossing. I was doing it all wrong before, you know, and I didn't know that. So it was a dental hygienist that corrected me on it. So you all are great help for patients. You mentioned the yearly preventive screenings and how you do the oral exam. And so some people may question some of that because it's not just you all cleaning the teeth and flossing. You know, the physician comes in and you all are moving the tongue around and you're feeling in the neck. And so tell them what you're feeling whenever you do.
Lymph glands, especially lymph glands.
Okay.
That is one of the major spots that cancer is or can metastasize to.
And you're just feeling for swelling.
Right. Abnormalities, probably the best way to describe it.
Perfect. Perfect. Well, let's talk about this genetic test that your office is offering. And you mentioned it a while ago that you actually are the one that will perform this test in the office. So just kind of start from the very beginning and explain what the test is and how it is administered.
It's a genetic oral cancer screening. The way it's genetic is that we obtain cells out of your mouth and send it to a lab for analysis. It tests for not only just oral cancer, it tests for HPV, which is a contributing factor to oral cancer, which we touched on before, and any DNA damage or abnormalities. We've caught other things that needed treatment with this test besides just oral cancer.
Okay.
So it's not the only thing it's looking for. It's very, very simple procedure. There are a couple pieces of paper that you have to sign. One's to obtain a little background medical history that the lab gets to look at. We don't even look at that in our office. Sign a consent form. I'll give you a bottle this big, put it in your mouth, swish and gargle until I tell you to spit. You spit it in a cup and it's sent to the lab. That's it.
Pretty easy.
Super simple.
So it's about just like getting some fluoride, right?
Right.
Yeah, it's quicker than fluoride, 30 seconds.
I know, it's a minute, right? Or 2 minutes? All right. How long has this test been actually out on the market? Do you know that? Or Not for sure
no,
about that
not for
one.
sure.
It's
on that.
recent. I know it's recently FDA approved
And how long have you all been doing it?
since January.
Since January. So why is that as an office you all decided to do this? Because not everyone is offering this test. So what made this look appealing to you all to think that this was a good investment for your clients?
I just think it further helps the patient's overall health. I think everybody would like to know if they have cancer.
Absolutely.
So that's, I mean, we're doing our part, it's the oral part of it.
I mean, by the time that you have a physical lesion in your mouth and then you're diagnosed with cancer, your success rate and survival rate is really short.
Right.
So if we can find it in a precancerous state on a cellular level and get you treated, I mean, it's just
The outcomes
fantastic.
are-
The outcomes are so much better.
Absolutely.
So.
You could be saving parts of someone's mouth, you know, that they would otherwise maybe lose. You never know. How much does this test cost a patient? Is it covered by insurance or is it all out of pocket? How does that work?
In our office, it costs you a $30 copay to take the test.
Okay.
That's not covered by insurance. I do feel like in the coming years that it's going to be covered by insurance. It's just they're not there yet. And we're dental insurance only. And that changes, dental codes change every year. So you may see that, but right now it's going to cost you $30 out of pocket. The lab files your medical insurance.
Okay.
So you do have to give us a copy of your medical insurance card that we send to the lab. I think the charges at the lab are roughly around $1,500 is what they're billing your medical insurance. However, they agree to accept whatever your insurance covers.
Okay.
So if your insurance doesn't pay anything, then the lab doesn't send you a bill.
Okay.
The only thing is if you have Medicare or Medicaid only without a supplement, it is a $400 copay to the lab.
Okay. And you all explain all that to the patients in the office?
Right.
Perfect. Well, that's not too bad then. If you do have insurance, $30, that's pretty affordable. So a person comes into the office, they give you their sample, and then it's sent off to the lab. How long will it take for those results to come back? And does it come to your office or does it go to the patient?
It takes about 1 to 3 weeks right now. It depends on how busy the lab is to actually get your results back. It comes to our office and to you.
Okay.
We get a color coded detailed breakdown of words that somebody might not understand.
Right.
And what comes to you is a nice letter that says, Miss Smith, your test came back perfect. Please see your doctor again in 12 months.
Okay. All right. And so what are the results that are given? Say if they have negative results, say if I did get a letter that just said I was perfect, there were no abnormalities or anything like that found, when would you suggest the next test be done?
Be every 12 months, yearly.
Okay. Okay, so you just add that on to the yearly routine. And what if the patient is placed on a watch or a high risk result? What does that mean, first of all, for the patient? But then what do you all do with that patient after that?
We monitor them and suggest that, you know, every year you get rechecked.
Okay.
And without fail, I can't stress that enough.
Okay, so you would definitely want them back every
Right.
year.
Right.
And so if someone's put at high risk or a watch, that doesn't necessarily mean that they have a definite positive result, right? Is it kind of on the border suspicious?
Suspicious. There's probably some pre-malignant cells that are there. They found microscopically, and so they want to watch that.
Okay, just to monitor it more closely. And then, so what if a patient comes back and it's positive? It says, you know, what is the letter going to say to the patient? What are you going to do with the patient?
We're going to refer as the type of cancer that it is, where it needs to go, usually to a head and neck office like at Vanderbilt,
Right.
where they have a strictly head and neck oncology
Okay.
unit. That's probably the closest place here that I'm aware of. Besides, Louisville has one, and I'm not for sure if UK does.
Right, the cancer centers.
Right.
So in that, when it comes back positive, it will detail to you all what the positive was resulted in, whether it was HPV or, is that what it says to you all, or does it tell you exactly where it is?
And well, they'll say there's malignant cells. There's a huge probability that this is going on, and that's why we'll refer on.
Okay, perfect. And if someone has questions today, they want to maybe ask more questions about this testing, or maybe perhaps someone doesn't even have a dental home and they need to find a dental practice to go to each year, how can they get a hold of your office?
They can just call us.
Okay, and what's your phone number?
270-753-5052.
Okay.
And we're also available by email for anybody that's busy and needs to shoot off an email, and we can get back to them that way.
Okay.
It's jpickensoffice@yahoo.com.
All right. It's pretty easy in this modern technology world. Everybody has email or phone, right? All right. So is there anything else you want to add about this testing? I know that it's kind of detailed, but did we leave anything out that any consumer out there might need to know?
I want to stress to the patients that it's so simple. A matter of swishing some solution around in your mouth for 30 seconds, and boom, it's over with, and you're going to get some results.
Absolutely. I do have one question, just as a parent. You know, we often don't know when we need to take our child in for the first appointment. So at what age do you recommend that you actually start seeing patients?
2 to 3 years, depending on the child's maturity.
Okay.
If it's the first time and nothing but riding up and down in the chair,
Yeah.
things like that, just to get them used to it, not coming in and have something done to them right away. Just let them see what it's all about.
Yeah, I know. I took my little boy, my oldest boy goes, and so I let him go watch his older brother get it done, and then he wanted in the chair, just
That's
like you
a great
said.
idea.
Wanted to ride it, and then he wanted to have his teeth counted, so he let the dentist count his teeth. And so I've always had great luck with my kids at the dentist office. They actually enjoy going.
Some do,
Yeah.
some don't.
Yeah.
Just like adults.
I know. It's one of those things we need to do. So let's talk then a little bit about more about these yearly exams, and how long do those visits typically last whenever they do go in for their oral, cleaning every year. Let's let the people out there that know, maybe there's a lot of people out there that have never been to the dentist, so what can they expect? And let's alleviate some of those fears that people have. So what do you do as a dental hygienist to help people?
Well, if you are not a patient of record or haven't been somewhere, what we like to do the first time you come in is get that full mouth series of x-rays that Sherilyn talked about earlier, just so that we can see all of your teeth in detail. And then we get a clinical exam, which includes the look and see oral cancer screening, looking at any restorations that you have currently, anything that you might possibly need done to your teeth, and then establishing where you are and what you need to do from there to go forward, to get yourself healthy enough to put you on that 6-month rotation.
Okay.
We always try to correct the worst first. So
Right.
that's the way we do things.
Okay, just get them to where they're in a manageable.
Right.
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 What about, you mentioned earlier periodontal disease. I mean, how is that identified? How do you look into a mouth and know? What do people, if someone's at home and they wonder if they have it, how would they know? Or is it something that you all have to look at to be able to see?
Well, the main thing is the full mouth x-rays,
Okay.
bone level. Periodontal disease is a loss of bone in the mouth. You can have perfect teeth. If you don't have bone to hold it in, your teeth are gone. So that's what we're looking for. Diabetic patients are very prone to periodontal disease. So that's a great reason to come and have if you're diabetic. And leaving abscesses, bad teeth causes heart problems, liver and kidney problems. So that's another great reason to come and get checked out.
That's absolutely a good point.
Right.
And that could lead to a lot of chronic diseases.
Very much, and further that disease stage that they already have.
What about the gums? I always hear a lot of things about, making sure the gums are healthy, and they can, do little tests each year when you go in for your visits where they see how the gums actually are. What are they doing with that, and why are the gums so important to the mouth?
You're talking about periodontal probing.
Okay.
That's measuring the gum height from the base of the pocket to the tip of the gums. 1, 2, and 3 millimeters considered healthy. Anything 4 and above is considered diseased or unhealthy.
Okay.
When you're talking 6+ range, you can't clean that at home. It's just not attainable for you. And that's when you're talking about the shorter recalls where we're cleaning those out, seeing a periodontist for specialized treatments, reducing those pockets. But it's just the amount of depth of how far underneath your gums you can fill that up with food and debris.
Okay. That's great knowledge to know. I mean, a lot of people don't know that.
Right.
You know, you always talk about that and you hear about it, but no one has ever really sat down and explained that. So
And that pocket depth is all dependent upon the amount of bone loss there is.
okay.
So that's why it's so important to have the x-rays to see what's going on there.
You can learn a lot from x-rays.
Right. And we use digital x-ray in our office, so
Okay.
it's a whole lot more safe to do it this way. And we've been doing that for a long time. And
Okay.
very easy and very fast versus the old way.
You mentioned the bite wings whenever you first started talking about x-rays. Can you explain what that actually means? Because a lot of people may not understand what bite wing means, especially if they've ever had them done.
That is just a film that is placed inside your mouth and you bite your teeth together, and from the angle the x-ray is taken, you can see in between the teeth and see if there are cavities.
Okay. And then how is that administered? I mean, how is the patient protected from the radiation other than just what's exposed?
We drape the patient with a lead apron, and that,
Blocks it.
yes.
Okay. Go ahead.
It's actually, with the digital x-rays, you get more radiation talking on your cell phone or spending 15 minutes in the sun than you do from a full mouth set of x-rays.
Okay.
We still use the lead apron because that's what people are used to and that's what they expect, but it's not even a necessary precaution anymore.
That's good to know. I mean, I've never heard that either. You always think, and that's a big fear to a lot of people, is the amount of exposure of radiation they get. You know, they say, well, I go here every year and I have x-ray, I go here every year and have x-ray. They worry about stuff like that. So it's good to be able to know that, because certainly that's not talked about widely in the public. What do you all think is probably some of the biggest fears and barriers that you see as patients as to why they don't come in every year for their annual?
The perception of pain. Everybody thinks it's going to hurt. And we use anesthetic now that there's an anesthetic called Markey. It lasts a long time. We use that. And you should not feel pain in the dental office, period. So that's probably the biggest thing. And financial.
Yeah.
It costs. I mean, just like if you have something wrong with your finger
Yeah.
or your leg, it costs. And that's just the unfortunate side of healthcare.
Right, but just things that you mentioned today, you know, oral health is a preventive
Right.
measure for so many other things that
Right.
can affect our bodies. So it's definitely one that we really want people to think about and make more of a high priority.
Preventative care is the cheapest way.
You're right.
And we're having more and more surgeons, especially and healthcare providers, send patients to our office before they can start cancer treatments or before they can have organ transplants or even knee replacements to make sure that there's nothing in their mouth. And that's because they are finally understanding too that it needs to be a symbiotic relationship.
Absolutely. That's a very good point. We have lots of cancer patients that we have to help find dentists for them to go to be able to have some of those teeth pulled or
Right.
things like that before treatment.
Right.
That's a great point. Well, let's just kind of go down the list and talk about what you want, your most important message. Maybe it has to do with the actual job you do at the dental office, but what is the main message you want people to take away from today? We'll start with you, Sherilyn.
Well, as far as the oral cancer screening goes, definitely do it. It's such an easy test, and like we said earlier, a lot of oral cancers and other issues can be asymptomatic. You won't even know anything until you're told, and sometimes it can be way too late. So
Right.
why not find out early?
Right. A dental hygienist, I'm sure you can talk all day about what you see.
Prevention. Everything that you can do at home to help yourself, please do that. And when you're ready to come see a dentist, you're more informed now after listening to this show. And ask questions. when you see your dental hygienist. I love it when my patients ask me questions. And no question is silly. I'll answer it to the best of my ability. Even if you have to come back some other time and sit down and talk about something, that's okay too.
That's good. It's good that you take time with patients. What about you as a physician? I'm sure you just...
I think the most important thing is for people to come.
Yeah.
Why stay at home and hurt? I have a hard time comprehending that. I know I wouldn't stay at home and hurt. I mean, we're here to help. That's the bottom line. Every dentist is. And the old misconception of it, I understand, but it's not that way anymore. So go see your dentist and get yourself healthy.
Right. And if somebody is worried about that medical cost, I mean, do you all work with patients in the office that are maybe uninsured with dental, they don't have dental insurance? I mean, are there payment plans that you can work out with them?
We have lots of patients in the office that don't have dental insurance, and they're private pay patients. If your costs are going to be expensive, we set forth a treatment plan with you, and each appointment, how much that's going to cost, what your total is going to be, about how long it's going to take to complete your treatment to get you healthy again. And we work with a couple of vendors to establish payment plans where we can do a 6-month or 12-month no interest for those patients.
That's great. Where there's a will, there's a way,
That's
right?
right. That's right.
Well, I want to personally thank you all for coming today and sharing this information, not only on oral health, but obviously this MOP testing, genetic testing that people can find out if they're at risk or currently in the process of having an oral cancer. It's great advancements that we've made in medical care, and that you obviously have the compassion and the concern for patients to be able to take those results and send them where they need to go for treatment so that you can perhaps save a life. So thank you for all that you do.
Thank you for having us.
Yes, thank you.
Thank you.
We want to thank you all for watching today, and if you have any questions about today's show, feel free to call Dr. Pickens' office and they'll be happy to answer any questions for you. Or you can call our office, the Kentucky Cancer Program, at 270-442-1310. Thank you for watching.